Let's talk ultrasound. What are your thoughts on ultrasound?
It's overused, first of all,
So
by far.
once or twice is max, not 3-4 times during the pregnancy?
Again, that should be individualized. But unfortunately, like I said, the medicalized birth model doesn't run on individual care. It runs on algorithms. Every woman who's got this issue, say she's got twins, say they're non-identical twins, or what are called di-di twins. Then they're going to have an ultrasound at 10 weeks. They're going to have another one at 14 weeks. They're going to have another one at 18 weeks, 22 weeks, 26 weeks, and then maybe start to have it a little more frequently. There's absolutely no data that supports doing that.
What for?
Well, they're looking for babies that are falling off the growth curve or growth restricted or something else. But there are clinical signs that that's happening.
Okay, but excuse me for interrupting, but let's say you see something during the ultrasound.
Right.
What do you do then?
Well, again,
make an abortion?
It depends what that something is. All right. So you're right. Most of the things you aren't going to do anything about anyway, except make the patient worry.
Correct.
And a lot of times you're going to see things that don't mean anything, but you're going to say, oh, you know, your baby looks fine, but it had this one little echogenic focus in the heart, which probably in the face of everything else being normal doesn't mean anything. But I want to see you back in 6 weeks to take a look at it. So what's the woman thinking about for 6 weeks?
Cortisol up.
Yeah, there's something wrong with my baby's heart, as opposed to the fact that everything else about the baby was normal. So,
And she can't sleep for those
right.
weeks.
And again, I'm not saying that all ultrasonographers or maternal fetal medicine doctors are nefarious, but there is a profit motive. The more you have her come back, the more money you make.
Yeah, charge over time.
Right. Which, if we could change that, we should change that. We should say, you get paid this much for an ultrasound. Any subsequent ultrasound, you only get paid this much. And if you do too many, you got to give money back. You know, I don't know if that's ever going to be possible, but I'm just saying there's got to be a way, and it's got to be financial to motivate people to do less, because that's how you motivate people. Trying to work on their ethics or their morals it doesn't work in the business world. It just doesn't. So yes, ultrasound is used too often. And the thing about the medicalized birth system is they do not believe that ultrasound has any downsides.
Mm-hmm.
They don't talk about non-ionizing radiation, but I will be honest with you and tell you there has never been a study on humans since the late 80s in China. The ultrasound machines have gotten more powerful.
Mm-hmm.
Nobody has studied the effect of ultrasound and non-ionizing radiation on fetuses. But we know that there's potential for tissue damage and neurologic damage as the neurons are forming from this radiation. And the use of 3D ultrasound to get those cute little pictures.
Correct.
And the color flow Doppler, which I mentioned earlier, which is overused constantly now. It had a narrow mission for babies that were diagnosed with growth restriction on 2D ultrasound to look and see whether or not it's safe to keep the babies going inside or whether it's time to come out, has now creeped to basically being turned on every single time a maternal fetal medicine doctor does an ultrasound. They can turn on the color flow because, as I said, they can bill for that. There's about $100 to $135 upcharge that they can add to their billing every time they turn it on. And that is also a form of high non-ionizing radiation. It's much higher than 2D ultrasound, which is the ultrasound. But again, my colleagues don't think there's any downside to that. And part of the reason they don't think so is because they don't get paid for not doing ultrasound. Imagine how the world would be different if you paid somebody for not giving vitamin K, or not giving hepatitis vaccine, or not doing extra ultrasounds, right? That suddenly they would be indications for not giving vitamin K and not giving hepatitis vaccine. But you can't bill for those. You can't bill for not doing something. You can only bill for doing something. I'll digress for a second. Forgive me, you're allowing me to do this, and I really appreciate you.
Sure.
Let my mind go wherever it goes. When you come to the hospital in labor, they do several things to you, right? First thing they do when you get there is they ask you a bunch of questions about how many stairs you have in your house, what your grandmother died from, how many piercings you have. Why is that relevant to a woman in labor? That's the same questionnaire they'd ask you if you're coming in to have your appendix out, or you come in with a broken arm. It's the same intake questionnaire they ask everybody. Why are you bothering a pregnant woman who's supposed to be in her zone to do that? Mm-hmm. But you have to do that in order to get admitted. Then they send you to the bathroom, or they might send you to the bathroom first, to pee in a cup and to put on a hospital gown. Typically, that's what they do at a hospital. I don't know if they did that with your wife, but did she get to wear her own clothes at the hospital? Do you remember?
Oh, the first time when she
she was in
delivered?
labor.
Oh, that was like 6 years ago. I don't remember actually.
Okay. Well,
But
generally,
that was not here in the U.S. That was in
generally they'll
country.
put you in a hospital gown. Now, first of all, that hospital gown signifies that you're a patient. It's already disempowering,
Correct.
right? And they have you pee in a cup. Then they're going to draw blood on you. Then they're going to start an IV on you. Then they're going to put the belts on your belly. They're going to do all these things to you. Every one of those things has a billing code.
Excuse me. Would you be so kind as to take the?
Oh, my watch off?
Yeah.
Yeah, sorry.
Thank you.
Every one of those things has a billing code.
Really?
Oh, yeah, they can bill for all those things. There's no code for not drawing blood. There's no code for not starting an IV. There's no code for not using their laundry. All right, this is the way hospitals work. They've even come up with codes now for allowing a mom to have her baby skin to skin. They can bill for that.
Say that once again.
There's a billing code now for allowing a baby, for when they put a baby skin to skin, they can bill for that because they have to have a nurse that's standing by. So there's a billing code for that. This is how absurd it's gotten. The reason I'm bringing these things up is because why do you need blood drawn? People will say, well, you got to know what her hemoglobin is. Well, why? She's perfectly healthy. She just walked in. She's fine. If she loses a lot of blood, yeah, you want to know what her hemoglobin is. But you don't really care what she starts with. You're going to treat her symptomatically. If she loses a lot of blood and she's perfectly fine, you're going to leave her alone. You might draw hemoglobin to see what she's at, but you're not going to transfuse her. But if she's unstable, you might transfuse her. So you need to know. But you don't need to know when she walks in the door on every single woman. If she walks in the door and her vital signs are unstable, then you can draw blood based on your clinical findings. But that's not how the hospital works. Hospital doesn't base it on clinical findings. They don't even trust the nurses and the doctors to do that. They have standardized protocols, and everyone has to follow the standardized protocol. If a nurse doesn't do the things that they're told, the nurse will get yelled at on Monday morning. That's what will happen. Then they want to send a blood clot down to the blood bank because just in case you might need a transfusion. We have to be ready. Well, what happens if she came in from the car accident or a gunshot wound? You'd find blood for her right away anyway, O negative blood or whatever, you'd find it for her. You don't have to send it to the lab. Why do you send it to the lab? Because you can bill for a type and screen, which is what the lab is called. And the reason I say this is because when you go to a home birth, none of those things are done. She doesn't pee in a cup. She's not changed into a hospital gown. She doesn't get an IV started. She doesn't get her blood drawn.
Because
and
she's not
somehow
sick.
she and her baby live.
Yeah.
They survive. It's amazing how that happens. So they do all these things because they've always done them that way. When they cut the cord, they might give you 1 minute of delayed cord clamping because ACOG came up with 1 minute. 1 minute is a fake number. Why 1 minute? Why not 5 minutes? Why not 15 minutes? Well, because they don't want to wait that long. They have to move on to the next task. Leave the baby alone. Let the baby go on mom's chest. Leave the cord alone. Don't touch it. Leave the placenta alone. Wait till the placenta comes out. Then if it gets in the way, you can cut it. But no, they cut the cord. And then what they do in many hospitals, it's starting to change. Skin to skin is becoming the norm now. But in many hospitals, first thing they do is they cut the cord. They show the mom this beautiful thing that she just created. And then they walk it across the room and set it down in the warmer.
Why?
That's a good question. Because of habit. It's the Thomas Paine, one of our founding brilliant people in the United States, said the long habit of not thinking something wrong gives it the superficial appearance of being right. And so if you just do something for a long time, if you ask a nurse why she takes the baby to the warmer, or why is she covering your leg, why are you in lithotomy position in the first place to deliver a baby that's laying on your back with your legs up? It's probably the worst position you can be in. Right? You don't have gravity working for you. You're more likely to tear, that sort of thing. But it's convenient for the physician. You're that position because it's convenient for the practitioner. And then why, for God's sakes, are they covering your legs in blue drapes and maybe even washing off your perineum with betadine, which is that orange sterile stuff? Why are they doing that? It's not like they're going to take out your gallbladder, but they treat birth as if it's a surgical procedure. They're putting drapes on you. It signifies that it's a sterile procedure. Vaginal birth is anything but a sterile procedure. It's not supposed to be a sterile procedure. It's better for the baby if it's not a sterile procedure. It's better for the baby if mom pees and poops on her own baby. Seriously.
Explain that.
Well, because that's where the baby gets colonized with its original microbiome.
Bacteria.
Is mother's bacteria. Mother's bifidobacteria, it's lactobacillus. Those things are the things that you want to colonize your baby's gut The very first thing. If it's colonized with the wrong bacteria, it may take decades to fix that.
Decades?
Yeah. Yeah. Once bacteria are set up inside of you, it's very hard to get rid of them. And antibiotics, all it does is screw you up even more. Again, it's nature's system. Nature designed it to go well. Nature designed a perfect system. Does it always go right? No, of course not. But if you leave it alone for the most part, it's going to do what it's designed to do, and that is to get you a healthy offspring that's going to live a long and healthy life, to grow up, to reproduce, to make more healthy offspring. That's what we're supposed to be doing. All the things that man has done in the 100 years since the Rockefeller and the Flexner report sort of medicalized and pharmaceuticalized medicine have not made us healthier. They've made people incredibly wealthy. But the outcomes belie the fact that it's better medicine. We reached a point where we're doing okay, and then we've gone way beyond that now. We need to get back to common sense and nature's design and the beauty of a woman's body and how it works and how it's designed and how, without thinking about it, that sperm, she can conceive a baby, grow a baby, go into labor, deliver a baby, nurse a baby, heal, all without any thought given to it. It's a normal bodily function. Like you and I breathe and you and I digest food. We don't have to think about it. None of the things that we just talked about with a woman's body does she have to think about. As a matter of fact, when we think about those things, we can screw it up. Mm-hmm. Like, I like this format. I mean, I love here. But some people who've never done this format would come here right now. Their heart would be pounding. They'd be hyperventilating. And they might even be nauseous because their cognitive brain is overriding their primitive brain functions. And if you've ever had to give a speech, if you've ever had to go to court, you can see how your cognitive brain will override your bodily functions and you hyperventilate, you get nervous, you're anxious, you feel that thing. That's not what you're supposed to do when you're in labor. You're supposed to be in a very primitive brain mode. When your cognitive brain is involved, like when you're interrupted and asked questions about your stairs and your tattoos, and you're brought into the cognitive world, it causes your labor to slow down because you're secreting hormones that are anti-mammalian to labor, to natural labor. It's just not what your body's designed to do. It would be like your dog was in labor, say under your bed, and you have 3 little kids, and your little kids are sitting under the bed with the dog staring at it. The dog isn't going to stay there. The dog is going to get up and go someplace else.